Welcome, everyone, to another edition of 45 Forward, where our mission is to help you, our listeners, from Los Angeles to Long Island, age successfully, making your second half of life even better than the first. As we're gathering once again with family and friends during the holidays, most of us are eager to resume our annual social festivities. Of course, but for many people, especially isolated older adults, this is a lonely season. And it's not just these times. Research from the University of California, San Francisco found that 43% of adults over 65 say they feel lonely, which puts them at a higher risk for poor health. The COVID-19 pandemic has made social isolation worse, but it didn't create it. This problem has been growing for years, spreading across nations as well as across various age groups. In today's episode, we'll be talking with three distinguished experts about loneliness and social isolation and what approaches we can explore to deal with these issues. Eddie Garcia is executive director of the Foundation for Social Connection, a nonprofit organization that aims to foster evidence-based solutions addressing social isolation and loneliness. Marcia Slater Johnston is a journalist and founder of Make Room at the Table, an affinity group whose mission is to develop strategies to alleviate social isolation and loneliness among older adults. And Dr. Carla Perissinotto, an associate professor in the Division of Geriatrics, Department of Medicine at the University of California in San Francisco. She has gained national and international recognition for her research on the effects of loneliness on the health of older adults. These experts will cover a broad, provocative range of issues. How do you define loneliness as opposed to social isolation or simply being alone? Who's the most at risk for loneliness? What are the risks in terms of physical and mental health? What's driving loneliness today here in the U.S. compared to, say, in the United Kingdom, which has appointed a minister of loneliness? And how are experts across multiple fields and organizations partnering to analyze these questions and propose systemic solutions and policies to promote social connection? You'll discover how we can make a difference for ourselves and for others to curb loneliness, whether it's during the holidays or other times of isolation. So now let's meet our guests today. Eddie, Marcia, and Carla, welcome to the show.
Oh, thank you.
Thanks so much. It's great to be here.
Thanks.
Yeah, thanks, Ron. It's wonderful to be here. Thanks for having us.
Great. Delighted to have you. So this is a broad and complicated field, and there are a lot of different perspectives. So what I want to do actually, folks, is just start with perhaps each of you just giving a sense of how you got interested in the issue, a little bit about your career path, and what intrigues you about it personally and professionally. And so what's your particular perspective on it? So I think I'm going to start, we'll start east to west this time. So I'm going to start with Eddie, with you.
Thanks, Ron. So an interesting way to start, and I appreciate the change up there. So it's fun. For me, my career has really focused on vulnerable populations and the intersection of sort of public health and healthcare for the last 20 years. I have a strong background in the healthcare system and healthcare delivery system reforms, new payment policy, and how we move from a system away from paying for services and more toward value and more toward outcomes. As part of that journey, I have a background in public health and master's in public health. I've always been interested in sort of the nexus of economic policy, of social determinants of health, and how those have played a role in our health and well-being. So for my background is really around the whole SDOH, social determinants of health space. And so as part of that, with the growing concerns around social isolation and loneliness and their impacts on our well-being, it has really just been a natural progression for me in that space. From the broader perspectives for me, I'm very interested in broad-based solutions, so policy solutions and frameworks by which various stakeholders can engage to make an impact in the well-being of people across the globe. So really excited to be talking with you about those pieces.
Great. We'll be talking plenty about that. So now, Marcia, how about you?
Well, I am a journalist. I've been a journalist for more than 50 years, but I also wear another hat. I advise, and for 26 years, I've advised the Harry G. and Charlotte H. Slater Family Fund, which is a small family philanthropy that provides seed grants for pilot programs that improve the quality of life for older adults, and in this case, in the greater Milwaukee area. We fund in that geographic space. Many of the grants that we have given, either wholly or in part, have addressed social isolation and loneliness. And this is a subject that has been near and dear to my heart for quite a time. I have seen people close to me deal with isolation and loneliness as they grew older. I've had some experience with social isolation and loneliness. So that informed how I wanted and how I advised, excuse me, on the grants that our family philanthropy has given. But also, I was concerned, and many other people were concerned, about the loneliness and social isolation that has taken place during COVID.
Mm-hmm.
And it has, while the issue has always been there, COVID has exacerbated it, and particularly for older adults. And this has been a real concern. So in July 2020, I was one of the founders of a new affinity group called Make Room at the Table.
Mm-hmm.
Make Room at the Table is comprised of people engaged in the field of aging who want to develop strategies to improve the quality of life for older adults who are socially isolated and alone, and possibly come up with solutions that will actually alleviate the social isolation and loneliness, or at least mitigate it in some degree. And I'm delighted to have the opportunity to talk about social isolation and loneliness, because it's a subject that doesn't really come up very often in conversation.
Right. Delighted to have you. And then Carla in San Francisco.
Yes, all the way out in California, a little
Yeah.
bit far from everyone, but still somehow connected. So how about that?
Yeah.
So I'm a geriatrician and palliative medicine physician. And then prior to that, I actually, like Eddie, worked in public health and have a background in anthropology. And so really, I entered medicine with an understanding that what keeps people healthy or what impacts their health is not just what we learn in medical school, but rather everything else, and probably more importantly, everything else. And so in my own practice, in my own patients, I started seeing something. I didn't know what that was because I wasn't taught about it in medical school. And then that something turned out to be loneliness and isolation. And I was like, this is something we're not learning about. We're not focusing on, yet it's impacting our older adults. And so I started researching it. So I started with the research of understanding the health effects. And like Marcia and Eddie, I'm also very interested in what do we do about it now that we know that this is a problem, both on a personal, individual level, but also on a systemic and public health level, and frankly, international health level, if we really think more broadly.
Right. All important points. So let's just talk a little bit more about, just framing the issue. You've brought up a lot of different dimensions to it. I just want to have each of you think about, well, how do we define it? I mean, so we talked about loneliness, social isolation, just being alone. And there are different aspects of it, some more subjective or objective. So I want to talk a bit about how you and other researchers define loneliness. So maybe I'll start with you again, Carla, from a research perspective, and
Sure.
folks just jump in when, Eddie and Marcia jump in as you will.
Yeah, so I think from a research perspective, and really just from a anthropological perspective, if you think about it, the need to belong is actually something that's very central to being human, and actually, frankly, being an animal anyway. Everyone wants to belong to a tribe, so to speak. But I think the point that you raised, Ron, is that the objective and the subjective component is what's important. So to be lonely is actually something that is subjective. It's a subjective feeling. There is a deficit between the relationships you want and those that you actually have. And it is something that is distressing. So being lonely is not an enjoyable thing. That is different than social isolation, which is really more about the quantifiable number of relationships someone has. That is also different than being alone, because being alone may be by choice. It may not be by choice, but it's not always distressing. So this is important because I think some people take offense to these words and say, well, I'm alone, but that doesn't mean that I'm lonely. And that's absolutely true.
Right.
Or it may be that you're lonely sometimes, or for some of us, we may be married, we may be in a partnership with a family and still experience loneliness. And so it is something that can fluctuate over time. It can vary from one day to the next. As we saw during the pandemic, all of us, to some degree, if we were following rules, had some new isolation in our life, or we would call it physically distancing,
Right.
that led to some social isolation. And so this was a new thing. Now, not all of us became lonely, though. So I think those are some basic things to really get down, to really understand what we're talking about.
Right. And I think sort of conversely, just because it's loneliness is a subjective phenomenon, it's still real. It's
Oh,
something that people really experience and broadly experience. So I don't know, did you want to mention it, either Eddie or Marcia, add to what Carla said? I mean, you've talked about the social determinants of health, Eddie. So I don't know if you wanted to talk
Yeah,
about that a
no,
little bit.
Carla, of course, perfectly described, what I was thinking about, the distinctions between the two, and the sort of unrelated and oftentimes those synergistic. So that you can be isolated, not be lonely. You can have loneliness, not be socially isolated. One can lead to the other as well. So that I think what Carla was getting at is just how complex this is. And it really takes on an individualistic nature.
Mhm.
And I think that's the key here, and the value of screenings, of adequate screenings, can't be underscored more, so that we can truly identify what is the issue that individual is experiencing, and then we can solution for that specifically for them.
Right.
I think the only other thing I'll mention is that the impacts of these, as you just mentioned, Ron, are very real. And those impacts are around our physical, mental, behavioral, cognitive, and economic health.
Mhm.
For instance, there was several studies from Carla and others to point that there's a nearly 30% increase in premature mortality
Right.
from social isolation and loneliness, equivalent to smoking. I'm sure you've heard this statistic, up to 15 cigarettes per day.
Right.
There's
Right.
increased risks of depression and suicidality on the mental health side, increased risks of decline, mental decline, a cognitive decline, and dementia. And a study by Cigna came out suggesting that it's cost the Medicare program up to $6.7 billion annually. That's just the Medicare program alone.
Right.
So as you point out, these impacts are very real from these two issues.
Right.
I
Marcia?
would just like to build on what Eddie said about the physical effects. I had a friend in her 90s who became isolated in Midtown Manhattan. She lived on the East Side. And I would call her, and she hadn't talked to anybody in a week. I called her every week, but a caregiver. And when I first started talking to her, there was this woman who could barely talk. I could hear her labored breathing. She was very depressed. She couldn't articulate very well. And as the conversation went on, her breathing calmed down. She started to talk in a normal voice. She started to laugh a little bit. And by the time we hung up 45 minutes or an hour later, I was talking to a different person. So I think that personifies exactly what Eddie is talking about, is how this can affect a human being physically, to be alone.
Yeah. Yeah, I one of the things I do is I do volunteering for the Alzheimer's Association.
Oh,
I'm a
wonderful.
community educator for them, and I do a workshop called Healthy Living for Your Brain and Body, and so it's really more it's a preventative thing. What can you do to reduce the risk of loss of cognition? And they mention uh, what you guys would know. So exercise, diet and nutrition, cognitive stimulation, social stimulation,
Mhm.
and it really does have an impact. From the Alzheimer's perspective, they don't go deeply into the research as you guys do, but there is certainly this aspect of loneliness that interestingly affects both the person with Alzheimer's or dementia, as well as the caregivers who often find themselves isolated and trying to take care of them. So it's a real thing, and it's a widespread thing.
Well, and I think what's interesting, Ron, is that, for me as a researcher and then as a clinician, it's been really fascinating. So the research that I did and published in 2012, so it's almost 10 years ago, which is kind of insane that it's been that long and how quickly time flies. But, I finally was able to see it in writing by research, what I was seeing in my practice: 45% increased risk of death, all these things. And then you see it in practice. And then the pandemic hit and we all saw it firsthand. This is what it means. This is exactly, Marcia, your story about your friend. This is what it means and how you actually see it happen. Before it seemed like this very non-tangible concept. And then we experienced it.
Right, right.
And I would like to say
yeah,
about caregivers is that one of the things that can happen to caregivers, whether they're caregiving for physically incapacitated or people with cognitive impairment, is that the caregiver, exactly what you said, Ron, becomes isolated. And then after that person passes away, they're at a loss. They've lost their social connections. They've sometimes lost their ability to connect with people, to form friendships, and they become, both isolated and lonely and very depressed. So that is a big problem, and it's one of the things that Make Room at the Table is looking at.
Right, right. We just have a couple minutes before break, but I just wanted to start on looking at a different aspect of it, which is, as you guys know, that so we focus on social isolation and loneliness, especially among older populations, but it's by no means unique to this population. And I think that's one thing that we're discovering more and more, that there are certain periods that are of peak, loneliness and isolation. And as you mentioned, Carla, it's not literally if you're alone. It's that feeling of subjective loneliness and disconnection. And so one of the areas is that I've seen too is that among younger people, which is people in their 20s experience the same sense of loneliness, even if they're in college, even if they're surrounded by their peers. So what I wanted to is when I'm gonna go to break in a few seconds, but when we come back and talk a little bit about that, about the differences of this experience at different ages, and also as part of that, not surprisingly, the role of technology in that whole equation. So folks, we're going to take a quick break, 2-minute break, but we'll be right back with a lot more from Marcia, Carla, and Eddie. So don't go away. Welcome back, folks, where we're talking with Eddie Garcia, Marcia Slater Johnston, and Carla Perissinotto, 3 nationally recognized experts on social isolation and loneliness. So before the break, we were talking about the fact that while there certainly is a major impact of loneliness with the older populations, the 60, 65 plus and older, it's a phenomenon that affects many demographic groups. So talk about that, guys. I know that it's prevalent among 20-somethings and then at various parts of life. So what's going on at these various peaks? Do we have a sense of what's happening? Why this is the case?
Ron, so I'll just start off, to your point, and I'm glad you're bringing this up. I know this is a talk show for the older Americans, but to your point, this really is something that's impacting all populations. Study after study, poll after poll shows that it is all populations, all walks of life, across the gamut. However, we saw before the pandemic and after, to your point, younger generations are at least reporting now to have higher rates of social isolation and loneliness. In October 2020, a study came out reporting that Generation Z reported being 20% more isolated and 85% more lonely than persons 50 years and older. Now, again, there could be issues here around reporting and bias, I'm sure, but directionally, I think that we're seeing that across study after study. And you asked earlier, so who are these other groups that are most susceptible? And it's logical. It's those groups of persons who feel they do not belong to the majority of society on the loneliness side.
Right.
Excuse me. Those who feel that their gender identity, their race, their ethnicity, sexual orientation, other factors along those lines have excluded them from the majority of society. And that has presented in those populations from these studies as higher rates of self-harm, suicidality,
Right.
And attempts across the board. Just last week, the Surgeon General's office did something pretty rare. They issued a national advisory on youth mental health. And again, these issues are not exclusive to mental health. They are physical, they are cognitive, they are economic, there are other factors. But it's an opportunity for us to focus on a broad population base. And from our perspective here for this talk show, think about prevention, preventing the onset of further isolation and loneliness in older age. It's a real opportunity, and I'm glad that we're highlighting that here.
Right, right. Yeah, I think that yes. First of all, yes, my target for the show is for 45 plus audience, but increasingly in life, as I covered senior issues earlier, everything is multi-generational. It doesn't really make sense to basically isolate these demographics from each other. So they're related to one another. And I think that one of the things that I wanted to ask you guys about is that it seems that some of these periods of heightened loneliness are related to what you were talking about, Carla, in terms of people get dislocated. They need a sense of belonging, and they're thrown off their community. Mm-hmm. So say for young, 20 somethings, they've gone through a period of life where it's been structured all the way through college, and that educational structure has kept them socially, structured as well regarding their families. Then they leave, and it's like, where am I now? Right. What's my network? And again, you could sort of see that logically happening later in life, when people approach retirement, they lose that connection again. Some of it through mobility. I think that's a big issue in today's society. The fact that we lose that sense of connection because we're such a mobile society. We're moving all over the place and moving jobs, moving locations, moving in every possible way, which is nice. It gives us flexibility, but it also, breaks our connections.
I think that's absolutely right. And I think and I don't remember who said this, but one thing that's a good predictor is that losses predict loneliness. And that is something that's agnostic. So as you mentioned, younger people, the move, the away from structure, that's a loss. You may be gaining something, but it may give you some time to regain that. I also think what's interesting, so as we get older, you're absolutely right, Ron, the changes in employment, the potential loss of a spouse, the redefinement of identity. We live in an ageist country that doesn't value aging. And so we're experiencing these changes that are predictors. It doesn't mean that happens to everyone, but it increases your risk. If you think about the pandemic, with older adults, we've seen different phenotypes, so to speak. So some people actually did okay. I would say I had some homebound older adults that I cared for were already used to, sadly, being isolated. And so suddenly being stuck at home was no change because they were already doing this. If anything, some people actually suddenly had more support because people were calling all of a sudden, right? But for those of us that had been more mobile, suddenly being stuck at home was a huge change. So, I think what's also interesting when you compare younger adults to older adults and the use of technology, which you started talking about earlier, is that, and I don't know, but I think there's some really interesting theories about how do we establish and develop relationships, and are our relationship quality the same when we work via technology versus in-person, in-depth relationships.
Right.
And Marcia, I think you're going to add.
Yeah, jump in, Marcia, on that topic.
Well, I want to say that those of us who are active in the aging field, and I'm sure Carla is aware of this, that one of the big things is intergenerational movement, the intergenerational movement, bringing younger people into contact with older adults and working together. And they do this in a variety of ways. When you were talking about technology, Carla, a lot of younger people have been conscripted or enticed, or whatever you want to call it, into being sources of tech savvy, to bring older adults onto the internet, making them digitally and educated and comfortable. And so the younger people help the older adults, and in that way, each age group is fighting loneliness and social isolation. The older adults are getting into where they can be plugged in and use the internet. And the younger people have a sense of satisfaction that they have really been making a difference. And they have also companionship and a different perspective on life. And so I think that's one way. But one thing that I wanted to mention about intergenerational, there's now intergenerational housing that's being built and considered. And in one of the organizations that I belong to, which is called A Village, the board of directors is integrating younger people. So there's a kind of like a junior board that's really a junior board of young people who are interested in the village, interested in what the older adults are doing. And together, you know, it really makes for a wonderful atmosphere, and it's really worked well in the pandemic.
Yeah. Yeah. Recently, I happened to yesterday be part of a virtual art opening here on Long Island, in which the curators of this exhibit, I think it was named something like Two Together, and it was basically they put together a program in which basically the younger person and older person actually collaborated on pieces of art, and they and on screen they had their piece, but then they also explained how they worked together, and you could tell that it was really engaging and really productive, and I think that that's something that you guys know quite well, is that part of, you know, a loneliness at any age. I'm thinking about older people, especially, you know, when you know, finish your, you know, relationships in getting married, have a family, and retire, retaining a sense of purpose and meaning in life, you know. And if you don't have that, that's a real lack, you know, as you said, Marcia, a sense of loss.
Yes. Yes. And I want to say that what you were talking about, your virtual art opening, the Harry Jean Charlotte H. Slater Family Fund funded, I think about 10 years ago, exactly that kind of project. But we did it with medical students, first-year medical students, and residents of a retirement community. And the idea of the project was that they would learn about each other's lives. They would each do an art project that illustrated some aspect of their partner's life. And then they exhibited them at a dinner.
Right.
And what happened was that the medical students and the older adults bonded. And even after the project ended, the medical students were going back to the retirement community and visiting their partners. And really, the bonds lasted for a very long time.
Right.
And so this is a way of combating ageism, and especially ageism in the medical field, and also combating loneliness on both sides of the aging spectrum.
Right, right. Well, you know, there are many dimensions to this, and what I want to do is to now shift a little bit to probably start with you again, Eddie. But one of the things that, and I'm sure Marcia, you know, as a journalist, knows, will know my experience here, which is that, you know, we journalists, when we do series and really take deep dives on subject, you know, we'll have a 7-part series, and 6 parts will be about, you know, parsing it and, you know, figuring out every possible dimension of this problem. Then the last one will be on, oh yeah, what are the solutions? So I'd like to reverse that and spend some more time talking about what are we doing about it. And Eddie, I mean, so we'll talk about some things people can do individually, but systemically, what are some of the things you're working a lot with, creating partnerships and working on policies? So talk a little bit about the foundation and also the coalition you're working on.
I think, thanks, Ron. And I should mention that both Carla and Marcia are members of our coalition and our scientific advisory council. So we're in good company here. But to answer your question, so we like to think about the various sectors and levels of impact that we can have collectively together. So more specifically, we're trying to think through right now and put together sort of actionable strategic plans and action strategies that, for instance, the healthcare sector can do, that the housing sector, employers, the education sector, transportation, you know, so things on and on. Each sector, and the way that we all live and those institutions that impact our lives, what role can they play? We also like to think about within those sectors and across those sectors, what are the broad-based policies from a national, global, state, local level that could be deployed? What can our institutions do within those sectors? What can our communities do as they interact with those sectors? How do we engage interpersonally and in engagement within those sectors? And then, of course, how do those sectors impact the very individual and personal perspectives? So we're putting together these sort of broad-based strategies across these sectors and levels of impact. And specifically on our coalition side, we're thinking through our advocacy strategy along those lines. So what can we do to increase the availability of social services and healthcare services? What innovative technologies or programs can we support from a policy perspective? What funding for research can we think through? And what global and national awareness campaigns need to be leveraged in order to have an impact in this space? But I see if Carla or Marcia have anything to add.
Yeah, I think that to add to that, Eddie, I think what's really great about this is that really we do need a systemic framework and a formal way to think about this, because just as we've talked about, loneliness and isolation are incredibly complex, and how one becomes lonely or isolated may vary from person to person. And so it's not appropriate to just say, this is the one solution, the one size fits all. But if we think about it systematically in terms of what sector can do what, in what way, in which population are we serving, we're better equipped. For example, what Marcia needs may be very different than what I need. So I've talked before that I was pregnant during the pandemic, not exactly, it was a difficult time to be pregnant and very isolating, yet the solutions that I needed to not feel lonely may have been very different than for someone else who just lost a spouse, for example. And so how do we think about this in terms of how do we help me as an individual, and how do we help other pregnant women who may be having a similar situation, for example?
I think, excuse me, I think that's very important. One of the things that Make Room at the Table has done to try to come up with a solution, we don't do any hands-on or services or research or anything like that. We are a think tank to look at ideas and what we can come up with and how they might work. One of the things that we have done is come up with lists on how to get through the holidays alone. Because the holidays are really a dreadful time if you're alone and isolated. One list is tips on how to celebrate a solo holiday. But the second list, which I think is the most important, is how, if you're not alone, you have everybody around you, you're going to have a wonderful holiday celebration, but how can you reach out to somebody you know is alone and make their holiday better and make them less lonely and less isolated? And I think that goes to a feeling that we have at Make Room at the Table, that the community is responsible for trying to alleviate social isolation and loneliness, and not just the lonely individual.
If I could just jump in there, I think Marcia said something really important, at least from my perspective, and I'll make this quick, that the community plays a vital role in leading programs and coalitions to tackle this issue. And there is a piece of legislation going through Congress right now called the Build Back Better Act. And it has a variety of very large sort of social programs and healthcare sector pieces of policy moving through it. One piece in particular is a part of the Elder Justice Act reauthorization, which would include $250 million for community-based organizations to deploy programs like what Marcia's talking about across the country. We vitally need that piece of legislation to pass Congress. It was in the House bill. It was just pulled out of the Senate bill. So would love to see that get put back in and passed before the end of this year.
Right. Yeah, these are complicated topics. And I think there are a couple of obstacles. I think, first of all, one is that a lot of things you're talking about are not only looking at the problems, but as you mentioned, Eddie, are prevention based. So it's hard to quantify prevention sometimes. It comes sort of, it's a looking backwards phenomenon. So you sort of see it in terms of reduced medical costs, but and one of the things is it makes the quality of life better, but it doesn't necessarily provide consumer spending. Right? So it adds the quality of life, and I think people really recognize the importance of that, especially during the pandemic. And I think there's also just when we come back from the break, we just have a couple seconds now, but I want to talk about this experiment in the United Kingdom where they have this minister of loneliness, because there have been some interesting results from that, and I wonder if some of that can be replicated here. And of course, it takes on what you've mentioned, Eddie, which is that it's a multiple approach. It involves a community on many different levels. So, folks, we're going to take another quick break, but don't go anywhere. We have a lot more to talk about in our final segment. So come back, and we'll be back with Eddie, Carla, and Marcia after the break. Welcome back, folks. We're talking with Eddie Garcia, Marcia Slater Johnston, and Carla Perissinotto, 3 nationally recognized experts on social isolation and loneliness. Before the break, we were talking about, just the impact of programs. I mentioned that in the UK, a couple of years ago, I think it was 2018, they appointed a minister of loneliness. And I'm wondering if you guys think that approach could work here. I think they've made some progress there. There've been the typical bureaucratic, missteps getting things going, but I think that they have been starting to look at some interesting, results from this.
I
would love
that,
to. Oh, go ahead.
No, I'll Eddie, you probably have so much more amazing things to say than I do, but I think at a very basic level, what I love about the Minister of Loneliness is that it means that this is a national priority. This is a national problem. It affects all of us. It is age agnostic. It has economic consequences. It has health consequences. It has social consequences. And that's what labeling that person does, is just saying, we can't ignore this.
Carla, we're on exactly the same page.
That's why we're friends and colleagues.
Maybe we're starting to have groupthink. I'm not sure, but Ron, to Carla's point, just to say it again, it catalyzes a national strategy and a national movement. And I don't mean just at a federal level. I do mean that all the stakeholders across the gamut play a role and have a sort of guiding star toward. And we're seeing that, of course, through the Minister of Loneliness in the UK, but we also just recently over the summer saw the appointment of a Minister of Loneliness in Japan, who has incredibly high rates of suicidality across populations. As part of our work in the Coalition End Social Isolation and Loneliness, we are the co-chairs of the Global Initiative on Loneliness and Connection. We've now built a new partnership with the World Health Organization, and a budding affiliation with the European Union's Joint Commission on Research to help catalyze this very topic of sort of setting national strategies and helping to instill point persons across governments that would catalyze movement in this way. In the US, we have persons like the US Surgeon General, who's taking this up as a very key platform issue. But even beyond that, the Surgeon General, I believe, needs even more authority. And so we would love to see a real chair on this topic for the federal government.
Right.
I think it's very difficult to get people to talk about isolation and loneliness. And I think that is a real barrier, certainly in this country. And people don't want to admit if they're socially isolated or lonely. They don't want to think, about other people who are socially isolated and lonely. It's like death, and it's like a lot of things that people don't want to approach. And I think it would be wonderful to have a minister of loneliness in the United States, or probably would have a different title.
Right.
But I think the point is that you would have to have public will, and you would have to have media support, you would have to have political support, and getting that certainly would be wonderful, but it is a challenge.
Yeah.
To your point really quickly, a poll came out today that said 78% of voters think that loneliness and isolation became worse for younger populations, and that the government needs to do something about it. So at least for younger populations, there's a large mass of political will and political support for this to move.
Well, and I think that's important, Eddie, because, I'm a geriatrician, so I study about the health effects in older adults, but I think what we don't know is what happens when we develop this loneliness or experience earlier and for longer periods of time. We don't really know yet what a dose response is. Like, how long do you have to experience this? I think we know from the pandemic that it was actually a very short amount of time you could start to have negative outcomes, but we don't know long term. And so that's really important to start thinking about. And I do agree with you, Marcia. I think we need to have several people agree we have to do something about that. And I would say that that includes payers. This has negative health outcomes. We pay for medications, we pay for very costly things that don't have big impacts on our health, but like, this is something that really affects all of us, and we need to take it seriously. And when I talk to my patients, I do talk to them about their social health. I say, hey, this is just as important, if not probably more important than some of the things I am prescribing to you. So let's actually talk about how we prioritize your social health.
Right. Yeah, I think that certainly to your point, Eddie, I mean, I think that this is something that the younger populations are certainly are aware of. I think we realize though that and I think some of the experience in UK pointed this out, that government plays an important role, but not the only role. And that there, when one thinks about community, that involves a lot of different components, or to use your word, stakeholders. And so there needs to be a lot of participation at a lot of different levels. And I think that, one of the things too is that, there are things that we can do and promote programs at larger systemic level as well as an individual level. One of the things that we started talking about was just the sense of meaning and purpose and connection. And so, people talk about, well, there are ways we can treat loneliness, but there are ways we can prevent it by increasing social connection. And, so one of the things is just people talk about, volunteering and service, as ways to help people get out of themselves and connect to others, and sort of see their value being recognized. Because I think that's one of the things I've heard about loneliness, is that there is this sense of loss of connection, but almost invisibility. And that's what a lot of seniors, they talk about. They feel invisible. So how do you make them visible? The invisible man and women. Go ahead, Marcia.
Well, one of the things, it's funny you should say that, because one of the things that we talked about Friday at the last Make Room at the Table meeting for the year is how can we make it easier for older adults to volunteer? And we looked at a lot of different ways that we could do that, and where we would fit in at Make Room at the Table, how we could facilitate that. So I think you're absolutely right about volunteerism. And I would like to say that one of the things too about volunteerism is that it's important when we look at it, to look at it for younger people, for people in midlife, and for older people, but also to look at it for many of the people whom Carla deals with, and that is people who are homebound. And these people really get lost in the shuffle. They really get cast aside. And one of the things that I think we need to look at is, how do we bring people who are homebound, who are bedridden, how do we still make them have a reason to get up in the morning? How do we make them feel that they are have some feeling of accomplishment? And just real quickly, I'd like to say that we were once approached in the Slater Family Fund with a wonderful program that had people who were homebound, older adults, calling people who were frailer, homebound older adults, so that these people who still had a lot to give, but just were physically incapacitated or had early Alzheimer's or something, were able to reach out, to make somebody else happy, to have a reason to get up because they had to call someone. And so we need to have more creativity in developing these kinds of programs that reach out to people who really get lost in the shuffle, not just in social isolation, loneliness, but just generally in society.
Yeah. I think you raised, that's a very good point, Marcia. And Carla, with your people who are homebound, that's one of the things that I think in terms of caregiving for our older population, There's a lot of conversation now, but it's really from almost a financial perspective. In other words, so people are pushing for these programs, for increased funding for these programs, mainly because it's cheaper than institutional care, and that may be the case. And I think certainly people, they do prefer, age in place in their homes. But then probably the most important, well, not most, one of the most important components, the social connection, is what gets left behind.
You're absolutely right. And I think what's interesting as we start to think about solutions is that, again, getting back to this idea that not, one size doesn't fit all, but a lot of current solutions are really focusing around new connections. But I have many patients that don't want new connections. They want to figure out how they can improve the connections they already have. So in my practice, some of the things that we did was actually help people get on with technology or learn how to use these things so that they could connect with family in other states in ways that they never could. Would they rather see someone in person? Yes, but short of that, when that wasn't possible or when it's not, can we reduce the barriers to connection? And that's how we start to do it. So lots of solutions, and it's just about being mindful and remembering the invisible populations at home. So thank you, Marcia, for reminding us of that.
And let's also remember, we're all in love with telehealth, and Make Room at the Table is partnering with some doctors from the University of Chicago on that very point. But one of our members, who's very, very highly placed in the aging world, pointed out that as you get people not going to doctor's offices, but doing it online, and as you have all these Amazon stores where there's no clerks or nobody, you just go in and buy things and go out, that you're taking away a source of human support for older people. And Carla, I'm sure you know this, for a lot of older people, especially older, frail people, to go to the doctor's office is their big outing.
Yes, absolutely.
And they talk to the receptionist, the nurse pats them on the shoulder, and this is a big social connection.
You're absolutely
so
right.
It's wonderful to have all these tech things, and I'm all for it, but we've got to find ways to substitute for the human connection that we are removing from people's lives.
Right. We just have a couple minutes to go. So I want to give Eddie, I want to give you the last word and some of your thoughts on what we want the legacy to be in terms of dealing with this issue.
No, I appreciate it, Ron. I certainly want to give my colleagues an opportunity to respond too. I think, I'd say partnerships is a huge issue here. And I think that we've touched on that in a variety of ways. But I can't underscore enough the need for us all to come together. And I mean all sectors, all stakeholders, the young, the old, everyone in between, and our need to work together to find the solutions to build back that connection. The Surgeon General talks about refinding our social fabric. And I couldn't agree with that sentiment more. And I think we can only do that together.
Right. Great. Well, we're going to have to reserve more for another show, folks. So I just wanted to take the last minute or so just to thank you folks for a terrific conversation. And I want our audience, if you missed this conversation, tell your friends. You can listen to it again as a podcast on voiceamerica.com. Search for my show 45 Forward, or you can find it on my website, rowellresources.com. Just click on the 45 Forward tab. And so folks, be sure to join me next week, Monday, 12 noon Pacific, 3 p.m. Eastern. I'll be talking with Miyoko Chu from the Cornell Lab of Ornithology about the world of birds and how it can enrich the world of humans, especially as we get older. So until then, folks, keep moving forward, 45 Forward.
All right.